Hello and welcome back, or welcome for the first time to my channel. I'm Davina, self-help author, psychologist, life coach, and New Thought spiritual practitioner. I'm passionate about personal empowerment and our highest growth and unfoldment. And today, I'm so excited to share with you another empowering and informative interview with an extraordinary woman and visionary doctor. Dr. Brandye Wilson-Manigat, aka Dr. Brandy, is a board certified obstetrics and gynecological physician. That's right, she is an OBGYN. She is one of the leading experts in women's sexual health. Dr. Brandy is a nationally recognized speaker and consultant whose passion centers around empowering her patients and providing excellence in healthcare. She is leading with extraordinary diligence and over 15 years of women's healthcare experience. Dr. Brandy has become one of the premier experts and sought after physicians in her community, often called Dr. Feelgood by patients and colleagues. As a friend and a patient of Dr. Brandy, I can personally say that she is professional, gives extremely practical and helpful advice that other physicians never bothered to share, and has an approach that is truly empowering. I don't know about you, but talking about my nether regions isn't a casual topic. However, Dr. Brandy is well versed and easy to talk to. She's cool with a great sense of humor and purpose. Dr. Brandy began her work with low sex drive from encountering numerous patients who believed they were going through menopause when there was a dip in their desire for sex. Thus began her mission to address the myths that women have around pleasure and sexual desire, focusing on creating space for women to have honest conversations, which is what we're going to do here, about what they describe both inside and outside of the bedroom. Being able to provide accurate information about the true purpose of sex and the physical, mental, emotional, and spiritual dimensions of sex were at the heart of her passion. Dr. Brandy is committed to teaching women how to reconnect with their passion, excitement, and desire so that they can get their sexy back. Before we begin our interview, let me just say that this channel is about information and education. It's not a substitute for medical care, psychotherapy, or other mental health or health service needs. Please take care of yourself and do what you need to do that is the best for you. And please take what works for you here and leave the rest. Again, please like and subscribe to my channel and leave your comments below. Please welcome Dr. Brandy. Yay. It's so wonderful to have you here today, Dr. Brandy. I know that was a lot to share, but you are an incredibly accomplished physician, providing so many wonderful resources for people. And it's really wonderful to have you here today to talk about women's pleasure, women's sexual health, perimenopause, and menopause.
Well, thank you for having me, Davina. I'm so excited to be here and to have this conversation. That's my goal in life is to create space for these conversations. So thank you for having me on, and I'm excited to be here and get started.
Thank you so much. I really appreciate it. And, you know, as you were working as a traditional gynecologist with women going through menopause, and your clients began to notice these differences, what were some of the differences that you did notice with your clients? What did they come in and talk to you about?
Well, there were several different things. One of the main things that I was seeing was a lot of fatigue.
Mm,
And that's actually one of the first symptoms that you can have of that perimenopausal transition, the menopausal transition. Um, what I was noticing was that women were coming in and they're like, "Well, I'm tired," and I'm like, "Okay, well, what have you done so far to kind of look into it and figure out why this is happening? Because we're all tired. We all have so
Gotta work,
much going on,
kids,
and
all
it's
the
like, right, kids, work in the house, like all the things." And what I was finding was that women were coming in like more tired than the usual, than what they were expecting to have. And they were getting their thyroid checked and
Mhm,
finding out, okay, well, that's fine. I don't have hypothyroidism, but what exactly is going on?
mhm,
So that was one thing. Another thing that I was finding was that I would have certain patients who were coming in for their annual exam, and I would ask them, how's your sex life, or is there anything of concern for you around that?
mhm,
And there were some women who, didn't say anything about it, and some women who were just like, this is like sex. Why sex? Like,
Uh-huh.
I'm 60 something years old. I'm done with that. That's a young girl's game. And it's
Uh-huh.
like, oh, no, not so much, but okay. I was also seeing
That's a
women who,
difference right there. Can I just say, I'm sorry to interrupt, but that's a
mhm,
difference right there. Like not every OBGYN asks you how your sex life is. They just kind of go in and, they do your pap
yeah,
smear and
we
you're
do
out.
the thing and then we're done,
Yeah.
right?
Yeah.
We're all like, oh,
100%.
do we have to do this? Okay, we're gonna do it and we're gonna get out. And
Right.
that's it. So yeah, so there were women who were like, oh no, my sex life is fine. I'm not having any pain. I don't have to use any extra lubricant. I'm doing good. And there was a difference that I could see from the mindset, but also physically. Like there were physical changes that you could tell and notice, like, oh, okay, well, you may be in menopause. There may be that lack of estrogen, but your tissues are not reacting that same way because you've
Uh-huh.
been regularly having intercourse and doing all the things. So that was another difference. I guess the third difference was women coming in and they're like, I haven't changed my diet, I haven't changed my exercise routine, yet and still, I can't seem to get this weight off.
Hmm.
And it's
Belly fat.
like right in the middle. And it's like, yes.
Yeah. What
And
Wanda
so
Sykes calls her Esther roll.
Right, right. Or the menopausal muffin, like
Uh-huh.
it's a thing and it's not cool. And then the last thing I was finding was a lot of women coming in and expressing that they were either having depression symptoms or more commonly like this newfound anxiety about everything. And it was like, okay, these are some of the main issues that, aside from the hot flashes, which is a whole other thing,
Another thing.
as I'm going through perimenopause and having these hot
Oh,
flashes,
amazing.
um, there were these other things that were coming up, but weren't necessarily being addressed by the training that we get as far as OBGYNs. Like now it's starting to be a thing.
Yeah, it's
But
finally starting to be
before,
a thing.
yeah, before it was just like, okay, treat the hot flashes, maybe treat the vaginal atrophy symptoms, and then that's all we got. Like, I don't know what to tell you about your mood. I don't know what to tell you about your energy. I
Yeah.
got nothing. So those were some of the main differences that I observed with my regular clients.
Well, I love that you asked them about their lives. And because you asked, you got this plethora of information of all the different symptoms and ways that they were being impacted by going through the change, through the lessening of estrogen, and how less estrogen in the body impacts just your global functioning from your mood, like you said, the depression, the anxiety, to sex drive, lubrication, to weight gain around the middle, to being fatigued and just not having the same level of energy, that those adrenal or cortisol crashes or whatever. And no one prepares you for this. I started going through this at 41, and I think that's a little bit early. I know people can go through earlier, but I still have friends that have not gone through it at all, and it's like, so I went through it for my peer group a little bit earlier and was not prepared and did not know what was happening. There were so many changes. And hot flashes, like you said, are just, oh, they're like, you can hear about a hot flash, but until you've had them, oh my goodness, right? It's just like you're
Absolutely.
suddenly soaking wet. It's embarrassing. And it just comes when it feels like it. And then some of the treatments, and I want to talk about how you work with perimenopause and menopause, but some of the suggestions were, well, just stop drinking coffee and, don't eat spicy foods, and it didn't make a bit of a difference. But
Yeah,
um,
yeah. So I definitely, yes. Like I'm going through perimenopause myself right now, and it's not fun. Just a little side note, like I'm balancing how to stay cool enough so I don't have a hot flash, but warm enough so it doesn't trigger my asthma. I'm just like, Jesus, can you help me? Can you
yeah.
help me? But yeah, definitely for me, it's a holistic approach to treating patients. Like it's not just here, take these hormones and you'll be fine, because there's so many other things that are going on. And like you said, estrogen is like we have estrogen receptors throughout our body,
Yeah.
not just in our reproductive areas. So
Right. I don't think most
it,
people know that.
right. And it affects things. You get brain fog.
Meaningful.
You get, feeling these anxious symptoms. You get muscle aches and things like that. So we have to address the whole person. And not every person feels the same things. So
Right.
you got to be able to, facilitate, like, oh, well, you're having more of this than this. Well, if we tweak this a little bit and do this, you should notice a difference. And so I try to have a more holistic approach and a more individual approach. I don't necessarily rely a lot on labs and things like that
Mm.
because especially during the perimenopausal transition, it's not just this precipitous drop in estrogen, like
Right.
the levels fluctuate. And so we can test you 1 month and your levels are absolutely fine. We test you another month, they're not fine. And then we test you
Wondered
the
about
month
that.
after that and they're fine again. So
Interesting. Yeah.
labs can be helpful for certain other things, but not necessarily for like estrogen, progesterone, stuff like that. Um, Especially in that perimenopausal transition.
So you could be having hot flashes, you could be having the anxiety, the depression, the brain fog, but when you go and check your estrogen levels, it's fine. So it's like, oh, you're not
Mhm.
going through perimenopause, nothing's happening, but it's like,
Right, you're good. And
hey,
it's like, but no, I'm not.
not okay. Yeah. Yeah.
Right. And that actually was one of the things that happened to me. Like I went and saw my gynecologist and I was like, excuse me, hi, I'm having all these hot flashes and things. Can you help me out?
Yeah.
And we tested my levels and it's like, no, you're not in the menopausal, perimenopausal range yet. And I'm like, yeah, but yet and still, like I'm about to pass out in the OR because I'm
Yeah.
too hot. Can you
Yeah.
help me? So there definitely can be a disconnect between what we see in the labs and what you're actually experiencing for your symptoms. So um, the one thing I will say, you can get your labs checked, and it may not make a difference in terms of what we're doing in
Uh-huh.
term in getting you the treatment and the symptom relief that you need.
Got it. Got it. And like you said, there's definitely not a one size fits all experience because some people don't have hot flashes. Some people don't have brain fog. Some people have a lot more feelings of depression and anxiety, and maybe also would benefit from having an antidepressant medication or something of that nature. So it really depends on what the person. So that's helpful to hear too, that there's not a one size fits all approach. And then also with HRT, which we maybe we'll talk about that in a little bit, but certainly not everybody can go on hormone replacement therapy. But I know when I was going through it, there was tons of fear, and no one would prescribe me HRT. And
Mm-hmm.
and I was like, I'm a holistic person, I'm a naturopathic person, I am not going on HRT. And I suffered for a very long time. And then when I went on HRT, actually things got better for me. But I know it's not for everybody. But that was a fascinating experience to see no one wanted to prescribe it. When I was finally ready, it was very hard to get anyone to prescribe it for me.
Yeah, yeah, and the pendulum has switched, has definitely swung
Mm.
in a different direction. So when HRT first came out, it was like every woman should be on it. Give every woman some of this stuff. And
Wonderfully.
then it was like, hold on, wait a minute. No, okay, nobody have none of this. It's bad for you. And now we've finally gotten to this space and place of saying, okay, it's not good or bad. It's just some women have risk factors that make it a little more dangerous for
Mm.
you to use it versus some women, you have to use certain formulations of things to be able to use it versus some women it's like, yeah, absolutely, take this and you'll be okay.
Right, right. Like if you've had breast cancer in the family or you've had breast cancer
Mhm,
yourself, it's not such a great idea. But
mhm.
if you haven't,
Well, it is, you got to, it's there's some finesse to
there's
what
finesse.
you
Okay.
can and can't have, that's all.
Yeah.
So yeah,
So again, talk to your doctor.
absolutely.
Yeah. Um, so I guess like you talked about overheating. What are some of the strategies that you've come up with to deal with overheating and hot flashes? Because I think that's important for people to hear too. And I'm happy to share some of the things that worked for me
Mhm.
as well.
Yeah, yeah. So in full transparency, like I didn't start having really bad hot flashes until last year, like September-ish.
Uh-huh.
Um, and it like I knew I had to do something because I almost passed out in the delivery of a
Oh
baby.
my
And I was like,
goodness.
oh, this is not gonna work for me. Okay, so what are we doing? What are we doing? So I literally bought like one of those neck fans
Yeah, I
to
have one of
help.
those. Yep.
Yeah.
They help.
So that's been a lifesaver. Like every delivery, every surgery, I'm like, where's my fan? I got to
Mhm.
have that on.
Yes.
Um, I make sure that I am well hydrated because when you have hot flashes, you're sweating and all that, you're not just losing water, you're losing electrolytes
Yeah.
too. So I actually use a hydration supplement, a hydration electrolyte mix. It's called Cure. And I like them because they don't have any GMO stuff. It's all natural. There's no added sugar or
I
any of
like
that
Gatorade.
stuff.
Yeah. Yeah.
Well, see, I used to recommend Gatorade and just like diluting it
Mm.
because it's so sugary.
Yeah.
And like with my pregnant ladies, I was like, we don't need to give you gestational diabetes
Right.
while we're trying to hydrate you. So let's dilute that. But with this, like I don't have to dilute anything. It tastes really good. And it's just all natural ingredients. And it helps me to stay hydrated. Because
Mm.
another thing that happens aside from losing the electrolytes is you get dry eye, you get dry skin, you get dry mouth with menopause.
Yes.
And it can actually lead to like oral health problems.
Mhm.
So you want to make sure that you stay hydrated because that helps your body to regulate your temperature too. Um,
And this is why we're talking about this is because no one, some people are talking about it's not talked about enough, and this information is not widely disseminated. And it's so important to know these things. So thank you. But yeah, please
yeah,
continue.
yeah. And then I have like more of like a layering approach to things. So now I'm like, okay, what can I wear? Make sure
Yeah.
I always have a jacket with me because the flip side of the hot flashes, like you get this big
Yeah.
heat surge and then you get really cold.
You're
And it's like,
freezing.
what is going on?
Yeah. It's so crazy. You're just freezing
So you
afterward.
gotta
Yep.
yeah, so you got to
Yep.
layer your clothing. Try to use as much like moisture wicking materials so that you're not left, with wet areas on your body,
Mhm.
because that can just be
Embarrassing.
off-putting for yourself, let alone if you're interacting with other people.
Yeah.
Um, yeah, so those are probably my top like three things that I make sure that I'm doing.
So I'll throw in a couple more. So yes, I had the fan. Then I had a small desk fan that I would take with me and put near my bedside. I bought an ice thing that you can put around your head or your neck.
Mhm.
Those are great. And you can buy some cooling, like when you sleep at night, because there's a lot of night sweats, and sometimes that's
Mhm.
when it's the worst. Is this the hot flashes and the night sweats in the evening? You can get a cooling pad under your mattress. You can get cooling sheets and you can get cooling pillows, which are
Yep.
wonderful because then they just help you sleep better because that is another thing that gets disrupted while we're going through perimenopause. And menopause is our sleep cycle, right? And getting
Yeah.
to pee and because of the estrogen loss.
Right, right. And it's a twofold thing. So one, just yeah, the hot flashes, night sweats, waking you up and disrupting your sleep.
Yeah.
But also, for whatever reason, well, not whatever reason, the lack of estrogen, it is leading to a disturbed sleep pattern where you either can't fall asleep quickly like you used to, or you can't stay asleep. And so those disruptions in your sleep patterns, whether it's from the hot flashes or night sweats or from just menopause in general, actually can contribute to more of the depression and anxiety symptoms. It can
Mhm.
contribute to more weight gain. Is
Right.
your body is like, I'm in a stressful state. We need to keep our energy, keep our fuel source. So we got to, keep on, hold on to those calories, turn them into fat. It's going right to your middle. Like there's so many downstream effects of one system of the body being thrown off by this lack of estrogen.
Yeah, and also something that I recently learned, which I didn't know, was that having less estrogen in your body begins to diminish your bone density. So osteoporosis is now, and osteopenia is something to have to look at. And again, there's not enough conversations happening about this, and that when you're starting to lose estrogen, it's a good time to actually start building muscle and doing weightlifting, which is fascinating. I did like some machines, but recently I've started doing weightlifting because I've read about how the importance of deadlifts and overhead presses and building muscle and doing things that impact the spine will increase your bone density, which you want to have because falling later in life shortens your lifespan. So you want to have good muscle tone and healthy bones. And it's just very weird. I think most women don't think, oh, I should go do weightlifting.
Exactly, because most women are like, I'm not trying to bulk up. I
Right.
just want to lose weight and look good. And actually, even before you hit menopause, you should be doing some weight training, some resistance training, as you start to lose muscle after you are hitting your 30s. So your muscle um, mass starts to decline, not precipitously, but it does start to decline. So you want to be doing some sort of weight resistance training, whether it's body weight, whether it's bigger weights, you go to the gym, or you have your own weight system at home. So definitely you want to do that. You also want to be supplementing with like a calcium, vitamin D supplement, so that you are giving your bones the building blocks to put things together. Because, like you said, in perimenopause and the menopausal transition, your body's systems for building bone slow down, and your body's systems for breaking bone down speed up a little bit. So you want to counteract that.
Yeah, it's amazing how many, thank you for sharing that. It's amazing, again, how many things, how many aspects of our body are impacted as we go through this phase of life, and how important it is to get this information and to really prioritize all of these aspects of self-care, which again can be hard because, right, this is the time we're in that sandwich moment, right, where
Mhm.
many people are taking care of children, they're working, and they're taking care of aging parents. But this is a time where your own self-care really needs to be the top priority so that you have the strength, the resilience, and the ability to handle everything else in your life.
That's right. That's right. And that's, for me, that's what self care is about. It's about pouring into your cup so that whatever you are giving to other people is the overflow. And so you got to make time for it. You got to make time for you. You are a priority. You are important, and you need this.
Yeah, thank you. Thank you for saying that. So let's talk about this is an important topic and one that you write about and speak about. How can we keep our sex lives and bodies juicy, so to speak?
Well, I think with a lot of the life transitions that we go through, it can be kind of jarring to have this new thing. And so, just starting with some self compassion, like, this is where I am. There's nothing wrong with it per se, but we got to do some new things, some different things. And what I found with the perimenopause little transition, menopause, being in menopause, and that whole just set of things, and then adding sex onto it,
Mhm.
it's like, oh my God, what, why, what, and why? So how I usually will counsel my coaching clients, because I coach women around this, is that, hey, there's some changes, there's some things, but this is an opportunity for you to have the best sex of your life. like literally, because a lot of women are, and a lot of like just society in general, women, men, like they don't know anything about the body, the woman's body, and how it works, and how there's at least 10 different spots on your body that you can stimulate for orgasm.
Mm.
Like there's one or two that we know about, and
Yeah,
we're like, okay, well, these are the ones.
one or
No,
two. Yeah.
there's a plethora of things that you can do to have an enjoyable sex life, and this can be a time for you to explore those things. For my ladies who are further in the menopausal journey, and they may have more of the changes with vaginal atrophy and things like that, and they're like, well, I can't have penetrative intercourse, and it's like, well, you have other spots on your body that you can use to achieve orgasms and have sexual pleasure without the intercourse piece. But if you want to do that, well, we got some things that we can do to help you get there, get back there too. So that's one thing, just changing the mindset that there's only one way to do it. And if you can't do it that way, you can't have a great sex life. You can absolutely have a wonderful sex life, better than you did in your 20s and 30s
And you write
at
about
this
those
time of your
things,
life.
and
Hmm.
you write about that in your book, My Oh My, right?
Yes,
Yeah.
yes. Hmm. And then the second thing that we talk about are things that help to increase blood flow to the pelvic area, because that is a diminished thing that happens with the menopausal transition. That can affect your ability to create enough lubrication to make intercourse less painful. That can actually impact your ability to have the orgasms that you used to have.
Right,
Like it can
orgasms
take,
change.
right, it can take much longer to get to orgasm. And then when you get to orgasm, it's not as intense or as pleasurable as they used to be. So
Mhm.
there are things that you can use, different personal moisturizers, lubricants, even different like essential oil blends and things like that, that help you to get through those symptoms, help you to increase blood flow to the area. Even just doing exercises, doing like yoga can help increase blood flow to the pelvic area. So that's another thing that we talk about, how we deal with the pain and with not experiencing so much pleasure with sex during this time. And then just having conversations with your partner if you're in a partnered relationship, because they probably have as little information, if not zilch information, about how to navigate this with you.
Yeah.
And so just having those conversations with your partner and being able to give feedback in an effective way, so nobody's mood is changed, nobody's ego is bruised. Like, listen, I like that a lot. I would really like it if we could do more of this,
Mm-hmm.
because I value this with us and I want to keep it going. But maybe we can try this way. So just being able to have conversations, not just one conversation, have an ongoing conversation that is centered on mutual pleasure and how we can make it the best for each person.
Yeah, I think that's so important, and thank you for saying that, and kind of showing how, kind of modeling how people can have that conversation. I know for a lot of people, sex is such a taboo subject. It can be hard to talk about it. It can be hard to talk about your own pleasure. There can be a grief process that people are going through because, like you said, your orgasmic function changes, it shifts, lubrication shifts. That can feel like embarrassing, or like maybe your partner feels like you're not as attracted to them, all kinds of stuff. So there's a lot going on at this time, and it can be hard to sort of adult up and have these conversations, but quietly kind of disappearing and letting your body atrophy and distancing yourself from your partner isn't going to make things better. It's going to only make things more challenging. So it is worth it, even if it's uncomfortable, to have these conversations. And maybe, start talking with your friends about it, because sometimes there's a taboo to even have conversations with friends, with other, women or people assigned female at birth, like starting to have those conversations about what's going on so you don't feel so alone, and learning, like you said, like a lot of people are, well, I've never been on a site where I've ordered, personal lubricant products, or this what stuff
Hmm.
that does this, or, and it can be somewhat embarrassing for people to do that at this point in their life. Maybe when they were younger, they might have felt like more exploratory or whatever, but it's important to really take back your body and your sex life. Dr. Brandy, I just read this article in the New York Times, and it mentioned something called the orgasm gap, and said that straight women are having fewer orgasms than lesbian and bisexual women. And I wanted to kind of ask you what your thoughts are on why that is, and also why it's important for women to have orgasms in the first place.
Yeah. So yes, there is definitely an orgasm gap. And there's a difference in the number. What it's defined as is there's a difference between the number of orgasms that um, a woman may have versus a man,
Mm.
and then also the difference between heterosexual women and their number of orgasms versus lesbian relationships and their orgasms. Um, so I think there's a couple different reasons. One, just total education about the female body and anatomy and
Uh-huh.
all of that. Like we're finally seeing research that's looking at, okay, well, how many nerve endings are actually in the clitoris?
Mm.
And is there just, the G spot versus the G complex? Now there's the G complex. So I think it's just one, just knowledge in general about the female body.
Mhm.
I think when it comes to lesbian relationships, um, because they're both women,
Mhm.
they know, hey, there's some different things that feel good that will work, and so you may be more likely in that sense to be able to experience orgasms more frequently than a man who doesn't have that same equipment, doesn't
Mhm.
quite know how it
Just
works.
understanding anatomy, the
Yeah,
anatomy helps. Yeah, certainly. It's kind of like
yeah.
you have more of the answers to the test ahead of time, I guess.
Right, exactly, exactly. And then there may be some sense of a little bit more of safety and security that is there with a woman versus a woman, like
Mhm.
with a woman versus a man. Like
Uh-huh.
there was a a funny like video or whatever that was like, would you rather be stuck in the woods with a bear or would you rather be stuck in the woods with a man? And the woman was like, I take the bear. I take my chances with the bear. So
Uh-huh.
there is some level of sense of maybe insecurity
Mhm.
going into a heterosexual relationship versus a lesbian relationship. There can be that too.
So if you're in a heterosexual relationship, having a male partner that is really safe and focused on your safety and understanding and learning your body and knowing your anatomy is going to create more trust, more rapport in the relationship, and better sex life, better opportunities for orgasm.
Absolutely. Because in order for a woman to actually have an orgasm, to have a good sexual experience, there are parts of her brain that literally have to shut down or shut off so that she can relax enough to
Right.
have any kind of interaction
Yep.
sexually, let alone get to the point where she can have an orgasm. So that sense of safety is important. Like one of the things that I talk about in the book is about Maslow's hierarchy of needs and
Mhm.
where sex fits on every level of that. It's
Yeah.
not just in that first level of survival where you need food, shelter, water, sleep. Like it's in the safety and security. It's in those close relationships. It's in your ability to feel comfortable in your own skin. It gets up to the level of you being able to express yourself fully. And that's part of why having a great sex life is important. Like we try to compartmentalize it and be like, oh, this is just a frivolous thing. I don't need it. But great sex and great orgasms actually build your confidence in yourself.
Mm.
It has been shown to improve your creativity. It's been shown to improve your problem solving skills. So it's not just something that you can be like, oh well, it'll go where it's gonna go. It can go off to the wayside. No, it actually helps your vitality and your overall well-being. In addition to like you get a good release of endorphins, so it helps you with your mood. You decrease your blood pressure, decrease your heart rate, decrease your stress. That orgasm and the pleasure pathways actually help to um, decrease your perception of pain. So a lot of data we've seen, like if patients have migraines, they actually, if you're getting having an orgasm, that actually will decrease the pain that you feel from your migraines. It's a way to burn calories. It's a fun way to burn calories if you're doing it right. And it makes you look younger. It makes you feel younger. It makes you look younger. So there's so many different benefits to having great sex and great orgasms.
So cognitive benefits, health benefits, feeling rejuvenated, more relaxed mental health benefits, and then obviously the benefits of feeling connection with your partner,
Mhm.
closeness with them, safety, intimacy. Yeah, that's
Yeah.
a lot of good reasons to not just let it go by the wayside, as you said. And I was chuckling before, as you mentioned, turning off parts of your brain. I did my doctoral dissertation on sexual relationships between heterosexual couples and lesbian couples. And one of the things that slowed lesbian couples down more than straight couples, but obviously because one of the members of the heterosexual couple would have been a woman, it would have slowed her down, was things like being stressed out. If you're stressed out, like men could have sex and be stressed out, women can't. So if the house is a mess, if there's clutter, that impacted, how often people were sexual. If people were overly tired, that would tend to impact women more than it did men. So it was interesting to look at some of the what impacts sexual functioning of men and women and how that plays out. So it is important to understand and know these things. And let's see, you mentioned some really wonderful benefits uh, of orgasms. You talked a little bit about the use it or lose it notion that if we're not using it, there's not blood flow going to that area, and that can create atrophy. Do you want to say anything else about atrophy? And then I'll ask you another question about how to improve our libido. But, vaginal atrophy, I think most people did not know it's a thing, including clitoral atrophy. And it's kind of shocking when you discover that this can happen to your body because, well, I mean, I'll shut up in a second, but like, well, men will have erectile dysfunction, and we know all about that and ED meds, et cetera. No one's talking about clitoral atrophy or vaginal atrophy and the loss of sensation in the vajayjay. So can you talk about that, Dr. Brandy?
Yeah, absolutely. So vaginal, the official term is vulvovaginal atrophy,
Okay.
meaning the structures on the vulva, which are the outside things, and the vagina, which is the inner musculature. So what happens with menopause and that transition is that there's less blood flow to the area, and that contributes more so to less of the typical arousal things that happen when you are engaging in sexual thoughts, sexual activity. So you don't get the engorgement of the tissues. You don't get the lubrication being produced like it normally would be. So that's like one piece of it.
Mhm.
The other pieces have to do with the actual structures and environment. So there's a decrease in collagen that's happening in the area, so you get a little bit more laxity of tissue. So that's where you get the prolapse with your bladder coming down or the vaginal tissues coming out. of the vagina, or at least just pushing into the vagina. When it comes out, it becomes a much greater issue, so to speak. And then you have the issue with the change in the pH of the vagina.
Mm.
So the microbiome changes, and you get less of the acidifying bacteria in the vagina. And so that can lead to irritation, that can lead to vaginal discharge, vaginal infections, a lot of different things. Um, so it's not just, oh, the tissues don't have enough blood supply. Like there's several different things that are going on at the same time that can make it um, difficult to get through your daily activities, because it's not just about sex. Like this also can lead to urinary incontinence issues. Like I said, the prolapse issue is another thing. You can be misdiagnosed with certain things. Like I remember the story about Halle Berry, where she had gotten misdiagnosed with herpes when it was actually menopause, and it was the changes that had happened with menopause. So um, it's
Interesting.
it's an important thing to talk about. It's an important thing to address, and it can be addressed. Like there are things that we can do to help, whether that's over the counter things like a moisturizer, um, using something like a coconut oil to help with lubrication, all the way up to using like a vaginal estrogen cream. That does also help with those symptoms too.
Yeah, I was hoping you were going to mention coconut oil and Dove soap and airing things out. Those are some of the things I've heard you talk about before. Uh,
Mm-hmm.
and
Mm-hmm.
do you want to mention why that's important? You mentioned,
Yeah, so
yeah,
absolutely. So the for the Dove soap, and for it, like airing things out, that's just general what we call perineal hygiene, what I call perineal hygiene. Um, you should not be using douches or feminine wipes, washes, all that stuff. Um, you want to use these things on the outside, like the Dove bar soap is on the outside, and I say use the bar soap specifically because there's sometimes things in the liquid form of the soaps that can irritate the vulvar tissues. So the bar soap, use that. It is a cleanser, but it also has a little bit of a moisturizer in it, so that it keeps the area, keeps the skin from drying out, essentially. Because that can lead to itching, irritation. If you're scratching so much, you get little scratches and things like that. You can go down a whole
mm.
rabbit hole of issues, dermatologic issues down there.
So
If
even though
this,
people are trying to sell you these like fancy, beautiful smelling soaps and whatnot, when you start to enter this phase of your life, you really need to be mindful of what you put on that part of your body.
yeah, well, I tell all my ladies, regardless of what stage of life you are in,
Okay.
you don't need to smell like a tropical sunrise, ma'am. You don't need that.
Uh-huh. You just
Just
need
the
to be
Dove
clean.
bar soap is fine. And just on the outside, don't put anything in the inside, because the vagina itself is a self-cleaning organ, does not need any help. It can do what it needs to do. So yeah, so all of my ladies, Dove bar soap. And then not having a warm, moist environment down there, meaning you're not wearing tight fitting clothes. When you exercise or you're going swimming, you take off those sweaty clothes or the wet swimsuit as soon
Right
as
away.
possible, because on your skin, you actually do have fungus, yeast that's there. It's a normal part of our skin flora, but in the right conditions, it can overgrow and give you symptoms
Mm.
of itching, irritation, swelling, redness, yeast infection stuff. And so we don't want you to cultivate an environment that helps them to grow. Um, so that's the airing out part. And I usually will tell women who are struggling with any kind of dermatologic issue in the vulvar area, like, hey, at nighttime, if you feel comfortable, sleep with no underwear on, whether you have like pajama bottoms on or you don't. but just no underwear so that there's some air circulation happening and just keeping the area nice and cool and dry.
That's
And
great.
then, yeah, and then in terms of the coconut oil, it is actually a great natural lubricant that you can use. The only drawback is if you are still having a period, you still can get pregnant. And if you're using condoms for contraception, it can actually break down the latex in the condom. So you'll have to use a different method of contraception.
That's really important information. Really important to know. Good. Thank you for sharing that. Any other tips on like three great tips on raising the libido?
Oh man, I have like 5 million tips on raising the libido.
In your book, my oh my, I'm going to plug your book.
Thank you. Thank you. So I think there's like three categories, I'll say, three
Okay.
top categories. So one is just like healthy living, healthy lifestyle, because those are the foundation for anything in life that you want to do. So from making sure you're getting enough sleep, making sure you're moving your body at least 10 minutes a day, for 5 days a week. You want to make sure that you're eating healthy, whole foods, especially in if there's any issues with like depression, anxiety, like you actually want to limit your carbs. You don't want to totally cut them out, but like simple carbs, you want to minimize that because it can actually make those mood changes worse.
Mm.
So you want to definitely take care of your health as a foundation. Secondly, you want to get it's not necessarily get your mental health in on order, although that's important. Like if you're having any depression or anxiety, that can actually lead to issues with libido and not wanting to have sex. But if you even if you're not having any mood issues, like we talked about before, with that being able to your brain being able to shut off or shut down some of those or decrease some of those
Stressful.
responses in the brain, you want to be able to have a calm autonomic nervous system and keep yourself out of that fight or flight space, because that just makes it harder for you to be able to relax and enjoy sex. It also makes it harder for you to be able to orgasm. You when you're in that stressful state, which most of us are every day, like it's a chronic stress, you have to find ways to dissipate that stress so that you can be in a space, in a place to be receptive to sexual activity. Because we're not thinking about that when we're in that fight or flight. It's like, okay, do I run from the tiger? Do I sit here and fight this tiger? But we're not thinking, oh, this is a great time to have sex and reproduce. So you got to get your nervous system calm, and doing that with like meditation, mindfulness, walks in nature, things like that. Just doing things that you love to do that calm you.
Mhm.
And then finally, just talking about it. We, again, we talked about how sex is a taboo subject and we don't talk about it, but
Yeah.
just talking about it will open the door to many different things happening. One, like if you're talking about it with your partner, just sharing that vulnerability actually improves your intimacy and makes you feel closer, makes you want to be close in that way with your partner. Talking about it with your doctor or with a coach like I do. Um, we get to normalize the behavior. We get to normalize what is happening and say, hey, this is normal. Hey, this is not. We also can give, different recommendations for how you can deal with certain things. And now there's starting to be a bigger push for a lot of doctors who are interested in sexual medicine and pursuing more education about it. But still, I have patients who are like, I try to talk to my doctor about this, and they're like, oh, well, it's just a part of your life right now, and you'll get over it. And it's like,
Uh,
no,
Passing it. Yeah.
there's so much that can be done. But I think on both sides, there has to be some education,
Yeah.
point blank, period. And then, just getting a coach, getting somebody who is knowledgeable about the anatomy, knowledgeable about the sex cycle itself,
Mhm.
because that we think it's a linear thing because we're taking data from men, studies with men, and saying, oh, well, a woman is just a man with a vagina. And that's not true. Like there's a whole different workup, a whole different system for how sex and sex drive and sexual pleasure operate for a woman than it does for a man. So having somebody to talk to about that. And then having a group of women who are your support, who you can go to and talk to know you're not alone, to get ideas about what you can try. That's also important.
Absolutely. Yeah. Thank you. And I think, like people like Dr. Ruth that were willing to have some of these conversations earlier on and kind of break through those taboos so that we can have these conversations. Certainly have seen in my practice where a woman starts to go through perimenopause, and if she's paired with a man, how there's like a pulling away, and so he may start to feel like she's not interested anymore. And there might be some things that have gone under the rug for a very long time that now need to come out. So resentments, things that, like you said, if those things are in your head, you can't be intimate with your partner. So it's both dealing with the unresolved conflicts that haven't been addressed, but also letting them know what's happening with your body. And they need to understand the changes, and there can be greater intimacy if you move towards one another and talk about those things. But if you don't and just go, well, I don't have libido anymore, I'm pissed off at him, it can actually, cause the marriage to fracture, for example, rather than
Absolutely.
come together. Um,
Yeah. And I'm glad you brought that up. That's an important point. Taking a couple steps back.
yeah.
So, women who are struggling with libido in the menopause, perimenopausal transition, often were already having issues with sex and sexual desire even before that time change, that phase, this new phase of life. And so it just becomes exacerbated with all of the other things that get put on top of that baseline issue. And a lot of it does come from resentments and bitterness that have built up that haven't been dealt with. So you got to deal with those. You got to have those hard conversations, and I promise you, you will be better for it on the other side.
Yeah.
Like you're avoiding these hard conversations, and it's just putting another brick in the wall between you and your partner and
Mhm.
preventing you from getting close. So thank you for saying that
Yeah.
about it.
So couples therapy, whatever you need to do to clean up that part of your life, for sure.
Yeah.
Yeah.
And if your
Or-
partner's not willing to go for yourself.
there you go.
You'll be amazed at what can be different when you are different.
Right. And ideally, it's like work on yourself, work on the relationship. And, some relationships are meant to last, and some that might be the time that you finally have the energy to leave the relationship. It just depends on each person's situation. So definitely don't want to tell
Mhm.
anybody to stay and don't want to tell anybody to leave. It's like, it's,
Right.
it's a,
That's between you and God.
yeah, exactly.
I'm not involved. I can help you with some things, but that's
Yeah.
between you and God.
Yeah. Yeah. Are there any books that you would recommend on women's health or menopause or anything like that?
Not necessarily any books. I've been following this Dr. Mary Claire Haver on YouTube, and I really like her approach to perimenopause, menopause, and the transition. I think we have a similar approach in terms of being more holistic and addressing, like, hey, get your gut health together,
Mm.
because that's an important piece to your overall health. What we're finding is gut health is important for cardiovascular health, which becomes an issue when you are in menopause. Like your risk for cardiovascular events, heart attacks, strokes, blood clots, things like that go up once you are in that menopause. So getting your gut health together,
Mm.
knowing that there's some things that you can do to help with the weight gain and getting that menopause middle to go away. There are supplements that you can take. There are exercises that you can do. Like there are things that can be done so that you start to shed that weight. And I just like how she approaches things when it comes to menopause and perimenopause and how to navigate that. And I think she just came out with a book, but I can't remember the name of it.
Okay, I'll look
But
that up
yeah,
and I'll put her YouTube in the comment section as well as your book so people can read that, My Oh My, as well as your website, drbrandy.com. That will be in the comment section as well.
yeah, awesome. And also, I have a, a guide that I put together for navigating the menopause and perimenopausal transition.
I get that.
Yeah, so you can get that at drbrandy.com. So DoctorBrandye.com.
Okay, so the is that a different website than the one?
Yeah, so Dr. Brandy MD is the all the stuff. This
Okay,
is specifically to get you to the guide,
okay.
and it'll help you to understand the changes that are happening, the things that you can do to get through this challenging time. And there's also a link in there so that you can get the top 5 supplements that I recommend for women going through the menopausal transition.
And can you say that website one more time?
Absolutely. So it's drbrandy.com. DoctorBrandye.com.
Great, and I'll put that in the comment section as well. Thank you.
Okay.
Dr. Brandy, is there anything else I haven't asked you that you'd like to share today?
I think we covered quite a bit. We did a good job, I think, in this time that we had. Um, if I had to say anything, I would say one, don't be afraid of hormone therapy. I think now there's more openness about using it and using it in a way that is healthy and is not adding extra risk to your health. So don't be afraid of that. And if you are with a provider who is either not knowledgeable or not willing to discuss it with you, then you need to find another provider, get a second opinion. And I know that's difficult in these days
Mhm.
because getting an appointment with a doctor is like months out
Mhm.
to do anything. So shameless plug, I do menopausal hormone therapy consultations with my telemedicine practice, Brio Virtual Gynecology. And I have availability that's not 3 weeks out. So
Ah,
we can have a
fantastic.
conversation, right?
No,
And
that's
then,
wonderful because I know like, again, I ran into you at a place that has lots of different doctors, and now I'm in a different place with one specific doctor, but I wasn't even considering HRT at the time when I saw you. It was much earlier on, but later when I was trying to get it, it was appointments were forever. Quite honestly, I don't know if I've ever shared this with you, but I literally snuck into I did guerrilla medical care and snuck into the waiting room because I could not get an appointment. And I talked to the charge nurse and I said, I absolutely need to see someone immediately. This is crazy. This can't go on any longer. And I cannot get the help that I need. And she was sympathetic, got me to an appointment, and I was able to see a doctor. And he was like, oh my God, yes, I will totally prescribe HRT for you. But it was crazy how many doctors
mhm,
I had to go through. And then I literally had to go down to a particular facility, wait for them to open the door and do guerrilla medicine. That's
yeah,
nuts. And
it's
I really
absolutely
share that
nuts.
because at that time, no one was willing to prescribe HRT. So that's wonderful that you are accessible in that way to folks. That's great.
Yeah.
Yeah.
And
Sorry, too much
then,
crazy information,
yeah,
but
right. No, because that's the reality of medicine right now. The traditional healthcare system is not working to get people, specifically women, the treatment that they need, the attention that they need, and it's
And
just not
there's a
working.
shortage, right? There's a shortage of gynecologists in Los Angeles, and that was part of it too.
All over the place. If I wanted to go work someplace else and just temporarily go, like I could do that. And there's spots all over the place. So there is a shortage. That's a whole other conversation
Yeah, so if
for
anybody
why
is
there's a
wanting
shortage.
a
But
second
yeah,
career or encourage their kids or nieces, nephews, et cetera, to go into the
yeah.
field of OBGYN.
I don't know if I would recommend that either. But
Oh,
here we
interesting.
are.
Okay.
Again, that's a different conversation for us to
Interesting.
have.
Oh, I'd love to have
Um,
that conversation.
yeah, but
Okay.
yeah. But
Okay.
the second thing I would say is just that don't, with the perimenopausal and menopausal transition, because it has such vast changes that happen throughout the body. Um, Make sure that other things are being ruled out and you're not just being labeled as perimenopausal
Mhm.
or
Yes.
menopausal, because there are other things that can mimic what is happening.
Yeah, you mentioned the thyroid, and I know when I work with folks who are depressed or anxious, it's, hey, can you, tired, please go get your thyroid checked. Please go get your, adrenals checked, see what's.
Adrenals checked.
Yeah,
Hmm.
absolutely. Right, because you do want to you don't want to just be written off as a hysterical female or a menopausal female when there could be other things.
Right.
You may have actual depression and need mental health help as well. Yeah,
Yeah.
absolutely. Yeah.
Yeah. Well,
Well,
thank you, Davina. This was so awesome. I'm so glad we got to chat.
me too, Dr. Brandy. Thank you so much for your time today. And you've shared so much. It's really wonderful. Thank you for being accessible. Thank you for the work that you do, the books that you've written. And I'm excited to put all that in the comments information so people can find you. They can connect with you if they want additional support and look at some of the other things that you've shared. And again, thank you for being a champion for women's health. Appreciate that so much, and all the ways that you've supported me over the year to educate myself. It's been really wonderful. Thank you for all that you do.
Thank you. Thank you.
All right. So again, you can find more information about Dr. Brandy on her website, drbrandymd.com. You can get the download that she mentioned at www.doctor spelled out brandy with an e.com. And again, we hope that this conversation today is helpful for you all and that you can share this with anyone that you think might benefit from hearing this information. Please prioritize your self-care, your well-being. You're worth it. And good luck to you as you are on this journey in this wonderful phase of your life. It is not the end, it's just the beginning of a new phase of life. So take good care of yourself.